My name is Bernita Roby, and I'm the Outreach Coordinator with the Chicago Women's AIDS Project. And the topic today is pregnancy and HIV. Today we have a guest that's going to help me out with this topic today. His name is Justin Markovich Garnett. In the absence of any intervention, transmission rates range from 15 to 45%. Women with HIV who take antiretroviral medication during pregnancy, as recommended, can reduce the transmission of HIV to their babies by less than 1%.
It is absolutely possible for an HIV positive mother to give birth to a HIV negative child. I know this because I am 21 years old and I was born HIV negative to an HIV positive mother and an HIV positive father. And, I was born at a time where, the likelihood of me being healthy and me being normal was slim to none. So with that being said, due to medical and educational advances, you're looking at what used to be a 96-97% chance. Now you're looking at a 2 to 3% chance since the mid-90s when that high risk was declined more than 90%. So when appropriate prevention is taken, the chances of your newborn is looking at about 2 to 3%. It's only by grace that I'm sitting here with you, Bernita, and that's why I advocate for women like my mother, women who desire a normal family, women who desire something that I feel every woman should be able to experience, which is, the love that my mother shared and instilled in me, and that's why I'm here. So to answer your question, yes, and I want to tell every HIV positive pregnant woman, every HIV positive woman who desires to be pregnant, HIV positive mothers, it is absolutely possible for you to carry out a happy, healthy, and successful pregnancy. Today, on this day 19 years ago, my mother, Tracy Markovich, passed away. She was the strongest woman I've ever known and ever will know. And she left me with a story, a story of strength, a story of love, a story of life. She left us all with a story. So on a day that is so dear to me, it is absolutely, I see no better way to spend it than to be able to share that story with others and to be able to encourage and empower other women like my mother, who just desire to live. Don't let anything stop you.
Years ago, when women were looking for family planning, it was just kind of the last thing on their mind was getting pregnant and being positive. It just, it didn't mix. But now, with medical advancements in education, it is possible to be pregnant, family planning without the fear of infecting your child. I'd like to just talk about ways that you could actually transmit the virus to the child, and that could happen 3 ways. First, sharing the blood supply. HIV passes from mom to baby in the womb, and also it's with the positive blood circulates in the fetus. Next is during the delivery. The child is exposed to large amounts of the mother's bodily fluids and also the fluids surrounding the baby. Finally, during breastfeeding, the breast milk has a very high concentration of the virus, and so if you do decide to breastfeed and are positive, it is a 1 in 4 chance that the baby could be infected with HIV.
However, with medical advances, if you do follow these preventional tips, you are looking at only a 2 to 3% chance of your child being born HIV positive. So with that being said, the first and one of the most important is continuing, even prior to pregnancy, continuing your medicinal regimen that has been given to you. However, when you are determined pregnant, your doctor will put you on a regimen containing the drug AZT, which is a preventional drug that will help you during your pregnancy. It will be given to you during your pregnancy. It will be given to you during delivery, and it will also be given to your unborn or your newborn child at his or her birth. The second preventional tip I do want to give you is delivery. The delivery of your child plays a key role in prevention, being that, when your child is born, it he or she will be exposed to your bodily fluids, which does contain the virus. So it is suggested that an HIV positive woman does receive a C-section at birth, simply because it is a quicker alternative and also exposes the child to less bodily fluid. And then last but not least, I want women to know that prevention does not stop at birth. As Bernita talked about a few minutes ago, avoiding breastfeeding is very important just because the breast milk is highly concentrated with the virus. So it is suggested that you stay away from breastfeeding after the birth of your child. AZT is a preventional drug that's used during your pregnancy. It will be used during your delivery and also given to your child at birth. And as Bernita said earlier, you can carry a child full term just as long as you take those preventional steps, be as safe as you can, just as any pregnant woman should. You're no different than any other pregnant woman. You just have to be a little more careful with the way that you treat your body. So it is absolutely possible.
Yeah, and then like I mentioned earlier, make sure that you eat healthy, no smoking, no drinking, no recreational drugs. Things like this will help you to carry full term without a problem.
I just want to give my love to every HIV positive woman, every HIV positive man, every HIV positive transsexual. There is so much more, than the virus. You are so much more.